I have ruined so many relationships. I have seen men, their heart drop to their stomach.
What was one thing you said where you saw their heart drop to their stomach?
I had a pregnant patient,
Yeah.
and we were happy. She had her partner. She was married, and they already had kids. And that day was a really tough day for me. Usually, when I'm tired, I'm more just brutally honest. And so my nurses usually warn you, like, "Hey, get ready. There was, a smell in the waiting room." Or, "Hey, the patient's upset. She has high anxiety." You get a heads up.
Yeah,
That
yeah.
day, I was given no heads up. So I came into the room, opened the door, and boom, got slapped in the face. Trichomonas. That stinks. And I was so upset with my nurse that she didn't warn me because I had doctors, we're human too.
You got the spouse and the female in there.
Yes, and they're both wearing sweats, so the airflow is not good. I come in, he's sitting like this, she's up on the bed like this, and I said, "Close your legs." And they had the children there, so I had to go close to them, and I had to say, "You have trichomonas." And they said, "What's that?" I said, "It's the STI." And immediately we both look at her partner, and that's where I can just see, his the temples, that vessel pumping, and he was, had a frog in his throat. And I said, "You guys can deal with the relationship later, but you cannot have sex until you get treated." And it's very hard to get men to go to the doctor and get treated, but they kept giving it back to her, and I said, "This leads to preterm labor, or if you're early on in the pregnancy, it can lead to miscarriage." So that's why we don't want you walking around with sexually transmitted infection. I talked to the nurses, and they're like, "Is that what that smell was in the waiting room?" I'm like, "Yeah," and I coulda got a heads up, and so basically, I made that visit shorter because I said, "I just can't talk to you guys right now. It smells, you guys know why, and I'll give you the treatment, and then we can have a telephone visit if you have any further questions." And I had to open the door, and it was so just potent.
Look, you guys, there are certain smells that are associated with medicine, and you can smell certain things and you can diagnose it,
I
like,
could
right
smell,
away.
yes, BV,
Yeah.
trichomonas, and chlamydia. This nose right here, okay, this nose, and you know what? My smell got better after pregnancy.
Did it?
Like, during pregnancy, I couldn't stand the smell of my husband, especially in the beginning. I was like, "You need to wash your hair. Something is going on here." And again, this is another thing that they say once you deliver the baby, your smell should go back to normal. But no, some days I think if I had this somnia, what is it? Hyperosmia? What is it?
Yeah, like, I think it's when you can smell extra.
Yeah.
I think it's osmia, I
Yeah,
think it's
hyperosmia, is supposed to go away, but now I can diagnose and I smell things, and some days, on my bad days, I'm like, "You know what? Why am I doing this?" My mother
Why
encourages
are you
me.
smelling?
Just why am I in this, like, field? Like, you know what I'm saying? Like, it's sometimes you feel, the smells are violent. This is the human part of me, and my mom reminds me that, women need help. That's why they're there.